Hi, my name is Erich, and for today's video, we're going to insert an IV and discontinuing an IV. First, we're going to introduce ourselves. This is my ID. Yes, and we're going to wash our hands for infection control, of course. For that will be for 20 seconds. So, and also we're going to um, introduce ourselves to the patient. Tell the procedure and explain what's going on, and also we're going to close the curtain for privacy and for the patient's privacy as well. First, we're going to for me it's the dominant and non-dominant side question, so we can ask that. So I prefer the non-dominant side because the non-dominant side is a lot more safer than the dominant side for precautions, safety precautions, and dislodging as well. Um, And second, we're going to palpate our hands by using gloves. Using gloves. And then we gather our equipments first of all before we start the procedure. I got the catheter here, the tourniquet, the alcohol pad, the gauze, tape to secure the insertion of the catheter, the skin that we're using for today, the catheter extension set. What else? And then I'm using a pad just for infection control again as well. We're going to clean the table for cleanliness and infection control as well. And then we're going to start now by looking for and palpating the site. So if you found the vein or the site that you wanted to start with, we're going to use the tourniquet. Okay, by using the tourniquet over the site. Not too tight because it's gonna affect the patient's arm as well. Gonna turn red. Okay, when you successfully do that, we're going to palpate again, and then for the site, we're going to dent using our thumb, dent or tilt the skin so you can successfully start the catheter insertion. Okay, this is the catheter. By using that, we're going to start and tilt the skin below for 2 to 4 inches. If you see a blood flow, then you successfully inserted the catheter to the right side. Then don't hold the site. Hold the tip of the catheter, and then you click this, you click that, so you can successfully release the catheter, and then take off the tourniquet. And then we're going to insert what we prepared earlier with the normal saline and the extension set that we prepared. First of all, I prepared it earlier already, so we can start right away the procedure, and you don't have to go get it from the thing. Okay, I already inserted the normal saline earlier and checked for bubbles. Then now we're going to use it for blood flow. So by doing that, you have to pull the thing up So if you already inserted and successfully saw the blood flow, then you have to flush it, the normal saline, to make sure that there's no bubbles around the area of the site or occlusion. Alright, when you successfully do that, we're going to leave the extension there, throw the normal saline to the sharp container, and then we're going to use the tape on top of the site. Now we're going to use another tape. That's the invisible tape, or that will be the transparent film dressing. Sorry, the transparent film dressing, and then we're going to use a tape to secure the catheter, or sorry, the extension. There you go. And then close the top with I don't have anything to close it around here, so for example, we close it so there's no leaking, and then we also lock it from here. And then we don't have to forget to put our initials and our date of the gauge or the gauge for the transparent film dressing, so we know when exactly was it done. Okay, and then now we're going to discontinue the IV. We have to just wash our hands again after the procedure. Everything, all of it, will be in the sharp container and trash. Okay, all of the invasive ones will be in the sharp container. Alright, so now we're going to start on discontinuing an IV. First of all, we're going to wash our hands, of course, for infection control. We're going to now use gloves. Okay, and then we're gonna put our sterile gloves. And now we're going to introduce ourselves and explain the procedure to the patient. After introducing and explaining the procedure to the patient, we're going to use this procedure, a gauze. Yes, a gauze. And then now we're going to pull the tape out with the transparent dressing, and then we're going to hold the skin. There you go. We're going to pull out the tape out of this transparent dressing. There you go. Just keep holding the catheter, and then before taking it off, we're going to put the gauze on top of it, and then we're going to take it off and hold it for 30 seconds until the blood is not visible anymore. Okay, we're going to hold that, or you can also use tape over it, but per instructions we're going to hold that for 30 seconds. And then if you don't see the blood anymore, then you are successfully discontinued the IV site. And then we're going to throw this away to the sharp container, and then we're going to wash our hands. Throw this to the garbage and wash our hands, and then you can successfully say that it was discontinued and you can go out. Thank you.